Certainly. Here's an article on the dangers of high potassium levels in the blood. Hyperkalemia, the dangers of elevated potassium levels in the blood. Potassium is an essential mineral and electrolyte that helps regulate muscle function, nerve signals, and fluid balance in the body. While potassium is vital for health, an excess of it in the bloodstream, a condition known as hyperkalemia, can pose significant health risks. This article explores the causes, symptoms, and dangers of hyperkalemia, as well as its treatment options. What is hyperkalemia? Hyperkalemia occurs when potassium levels in the blood exceed normal ranges, typically considered above 5.0 millimoles per liter, mmol. Mild elevations may not show symptoms, but severe cases can lead to life-threatening complications. Causes of hyperkalemia. Several factors can contribute to elevated potassium levels, including 1. Kidney dysfunction. The kidneys are responsible for filtering excess potassium out of the blood. When kidney function declines, potassium can accumulate. 2. Medications. Certain drugs like ACE inhibitors, non-steroidal anti-inflammatory drugs, NSAIDs, and some diuretics can interfere with potassium balance. 3. Dietary intake. High potassium foods like bananas, oranges, and leafy greens usually don't cause hyperkalemia alone, but excessive intake in people with kidney issues can be problematic. 4. Hormonal disorders. Addison's disease or hypoaldosteronism may reduce the body's ability to regulate potassium effectively. Symptoms of hyperkalemia. Many people with mild hyperkalemia experience no symptoms. However, as levels increase, symptoms may include fatigue and weakness, nausea and vomiting, muscle cramps and tingling sensations, difficulty breathing, heart palpitations, or irregular heart rhythms, which can progress to dangerous cardiac complications. The dangers of high potassium levels. Potassium plays a critical role in muscle contraction, especially in the heart. When potassium levels become dangerously high, it can disrupt the heart's rhythm, leading to arrhythmias and, in severe cases, cardiac arrest. Hyperkalemia can also lead to muscle paralysis if untreated. Diagnosis and treatment. 1. Blood test. A simple blood test measures potassium levels and assesses kidney function. 2. Electrocardiogram, ECG. In severe cases, an ECG is used to monitor heart function for abnormal rhythms. 3. Medications and treatment options. Diuretics. These can help remove excess potassium through urine. Potassium binders. Medications like sodium polystyrene sulfonate bind with potassium in the intestines to reduce blood levels. Calcium gluconate, used in emergencies to protect the heart. Dialysis. For severe hyperkalemia, dialysis can rapidly lower potassium levels. Prevention of hyperkalemia. Maintaining kidney health is vital. Those at risk should monitor their potassium intake and consult their doctor if taking medications that could increase potassium levels. Regular blood tests can help detect and manage hyperkalemia early. Conclusion. While potassium is essential for good health, excess levels in the blood are dangerous. Awareness of hyperkalemia's causes, symptoms, and treatment options is important, especially for those with kidney disease or on medications that influence potassium levels. If you need additional information, feel free to ask.